So I was asked to present you a presentation on breast reconstruction, and then we will speak about lymphedema surgery. So we will see a short history of breast reconstruction, then we will see the different families of means that we're using to do breast reconstruction. We will go through a new field which is called oncoplastic surgery. And then we will go briefly on a guide on how to do reconstruction, the indications, and then we will see the lymphedema surgery. So the history of breast reconstruction is about 100 year long, and it is actually mirroring the evolution of breast oncologic surgery. Starting with Alstedt, who actually completely contraindicated breast reconstruction at his time, and then to the point where now reconstruction is a law and is a right, and every woman needs and can be reconstructed, and this has to be covered by health insurance companies. So as I told you, the two history mirror each other and they evolve together. As I told you, the very first beginning of the history of breast oncologic surgery was described by Alstedt at the end of the 19th century. The ones who have been looking at the series called the Nix, the main character of that series is actually Alstedt. And he was the one who came up with a protocol very well described of breast surgery resection, which was called the radical mastectomy. You know that for that surgery, all the thoracic wall of the patient was removed down to the ribs, and that defect had to be left open. And at the very same time in Europe, in Pavia, which is a delightful city to visit if you are visiting Italy, a surgeon called Tanzini described 1 century before its time, because what we call today musculocutaneous flaps were described in the 1970s. And amazingly, Tanzini came with a technique of covering the defect of the breast patients with a local flap, the latissimus dorsi, that you all know. And that was described a century before it was actually described in 1970. Tanzini started to actually publish his papers on how to reconstruct and how to cover those defects.